Hello, we're here to meet with Dr. Nirmala of our university, Indian Institute of Sciences Health Center. We'll now be discussing about the problems arising from antibiotics and the increasing usage of antibiotics essentially, and also the possibility of using phage therapy as an alternative. Thank you, doctor, for agreeing to meet with us.
No problem. So your first question was on antibiotic use. You want information on antibiotic usage?
Okay. Yes, so generally on what purposes do you prescribe antibiotics?
See, antibiotics are used only for bacterial infections, whether it is pertaining to the respiratory infections or cutaneous infection. Cutaneous meaning skin infections. And then of course urinary infections, or if you are having gastrointestinal infections, that is when bacterial infections require antibiotic therapy. Okay.
So now what do you think are some of the biggest concerns from the rising usage of antibiotics?
Okay, the biggest concern would be the misuse of antibiotics. See, with more and more antibiotics getting into the picture, so there's a lot of misuse, especially in India. The misuse of antibiotic is rampant. So and there's no regulation about who can prescribe the antibiotic. If you go to a medical store and you tell him, I'm sure all of you would have experienced this, you go and tell him that I have a cough and cold, then immediately he will give you 2 doses of erythromycin or azithromycin. So even the medical store guy is able to prescribe medicines. Okay, so that leads to a lot of misuse, and also most often antibiotics are not prescribed appropriate to the infection. Certain antibiotics are to be prescribed for respiratory infections, certain antibiotics for gastrointestinal infections, depending upon what bacteria commonly causes the infection. So that also is not followed at least in India. In abroad, I think there is a strict protocol which determines what antibiotics have to be used for particular infections, depending upon the prevailing bacteria which causes infections in that area. Okay, so that is something that is not followed here.
Ma'am, do you remember encountering any such case, antibiotic resistance case in your professional career?
Yes. I remember a small girl. She was, at the time when I saw her, which was about 5 years ago, she was about 10 years old. Okay, and this girl was always given antibiotic for respiratory infection. See, being in Bangalore, children are prone to develop a lot of I wouldn't call respiratory infections. They develop a lot of airway diseases like allergies. Okay. So the mother was very overprotective, mother. So the pediatrician who was taking care of this child used to prescribe antibiotic for each episode of respiratory problem. Okay, I wouldn't call it infection. Okay. It could be allergies also. So the child goes with a cough and cold. Immediately after a day, the mother is not happy. She's not recovering. So they used to give her antibiotics. So one fine day, she had a skin infection. Okay, and then she was brought here, and it so happened I took a swab of the secretion, and it grew actually methicillin resistant Staphylococcus aureus, and it's very rare. It is called as MRSA, and because of this rampant misuse of antibiotic in this girl and prescription, she had this MRSA infection at a very young age, and somehow with proper treatment she settled down. But this gave a very good example of how misuse of antibiotic can cause problem in children, especially. Yes, with protective parents. I wouldn't justify the use of antibiotic by a doctor, even if the parents are very insistent on getting antibiotic treatment. But nevertheless, it so happened in that case the doctor had prescribed.
So ma'am, do you think that it is possible to reverse antibiotic resistance, given that the development of new antibiotics is significantly more difficult than it was a few years ago? Or do you think the time has come to look at just new forms of treatment?
No, I think it's very important to establish a protocol on antibiotic use. Okay, and that has to come from the government or any higher governing authority, and whereby protocols are established. Of course, it is there, but nobody is there to see or check if the protocols are being followed. That is, enforcement is always a problem in India. There are rules and regulations plenty. Okay, but who is enforcing it, who is checking it, that is not there. That has to be seen to. And once that comes, then slowly I'm sure we can reverse the antibiotic resistance. Because there's no point in going on introducing more and more antibiotics, because the same will happen to all the new antibiotics which are coming.
Yes.
Because I remember in 2000, not even in 2000, probably 1996, there are only very few antibiotics. We used to have a group called as, of course, amoxicillin, the penicillin derivatives, and the cephalosporins, they were not yet into the market. They were just coming in. I remember cephalexin, that was the first cephalosporin which came in. And there used to be fluoroquinolones, which is the ciprofloxacin was the first fluoroquinolone. And for enteric fever, which was typhoid, they used to treat only with ciprofloxacin, okay, and cephalexin. Okay, but now enteric fever is almost like many a times we find which is resistant even to ceftriaxone, which is the highest injectable antibiotic which we are having now. So I am pretty sure in another 5-10 years, even whatever newer generation is going to come, it will again, the bacteria will be resistant to it. The best way is to have a proper enforcement of the rules and protocols regarding antibiotic usage, and also to restrict too much, maybe the higher antibiotic should be allowed, it should be very rarely prescribed, and it should be allowed to be prescribed only by super specialists. It should not be available at the level of a pharmacy, which is independent pharmacy at least. If a hospital pharmacy is stocking it, it has to be prescribed only on the prescription of a super specialist. Otherwise, I'm sure the same picture will be there. Okay.
So, ma'am, antibiotic usage may cause endotoxin levels to spike due to lysis of bacteria. This was something you were thinking of working upon.
Okay.
So, how significant is this problem according to you?
See, it's very rare because not all antibiotics act in the same way.
Yes.
Understood?
Yes,
Some of them act in different ways, and they may not release the endotoxins. Okay, because not as far as my knowledge goes, some antibiotics act, they do not actually lyse the bacteria, they actually prevent the replication.
Yes, ma'am.
So such antibiotics may not cause this problem. I have not seen any cases of these type of endotoxic shock in my practice.
Yes,
but my practice is restricted to a primary level. So maybe this might be more common in an ICU setup where they see septic shock and so on. Okay.
Okay, ma'am. So, what are your views upon the introduction of, say, phage therapy to help alleviate all these concerns? And what do you think may be the pros and cons of doing something like that?
Okay. A phage therapy is probably, I understand it's very broad. I'll first tell what my understanding of phage therapy is.
Yes, ma'am.
Now, phage is basically a vector which is going to probably carry a sensitive gene to the bacteria. Is that how you're meaning to use it, or how do you mean to use the phage?
Ma'am, our understanding of phage therapy was essentially using bacteriophages to get rid of bacteria. So, So one of our usages was to genetically modify the phages to incorporate some gene which we want to get it expressed. Essentially what you were talking about.
So if that is the case, if that is the situation, it will be very good because drug resistance in bacteria is transmitted.
Yes, ma'am.
Okay, so if you can actually by any means introduce a gene which either deletes or negates the effect of the drug resistance gene, it will be good. But I am not sure how feasible it will be. But if something like that can come, definitely we can, you'll be able to modify the sensitivity of a bacteria to a particular antibiotic.
We were even thinking of utilizing, making the phage, make the bacteria produce cytokine.
To make it more sensitive that also is another way of definitely.
That's a part of it.
Because some bacteria do modify the immune system and then they are not easily recognizable by the immune system. Yes, that is also good.
So, thank you for
your views. I hope it was useful.
Yes, ma'am. This will go a long way.
Okay.